Shalom Aleichem, welcome back to the Clinical Halacha series. Today we are going to discuss perhaps one of the most common medical pathologies that are encountered by doctors, by nurses, by hospitals, and by parents, by grandparents, and by anybody, both in the common era and going very far back as well. And that is the concept of fever. First, we're going to discuss some of the medical aspects of fever, maybe the pathophysiology of fever, maybe some of the benefits of fever, and then we're going to go through some of the sugyas, some of the gemaras, and the poskim, the rishonim, and the achronim, to get a full grasp and understanding, both medically and halachically, of the concept of fever, which the Gemara refers to as ashisa. Before we get into the Gemara and the halacha, let's go through some of the medical information first to understand some of the etiology and understanding of fever. Fever generally can be caused by the body in one of two ways. Pyrogens are the molecules that cause fever. These are molecules that stimulate the body to increase the temperature of the body. It can be either exogenous pyrogens, meaning that they come from outside the body. Sometimes gram-negative bacteria can produce certain molecules that stimulate the pyrogens, or it can be endogenous pyrogens, pyrogens that come from within the body, such as the cytokines, interleukin 6, 1, and some of the tumor necrosis factors as well. So how do these pyrogens work? They just tell the body, like, get hot all of a sudden? So we know the body has a hypothalamic point. The body has a hypothalamus that regulates temperature in the body. And when these pyrogens are activated, so they reset the hypothalamic point. They actually raise the hypothalamic point of the hypothalamus, and therefore the body tries now to match that point. We want to get to where the hypothalamus tells us we have to get. That's usually through COX-2 and prostaglandin and other types of molecules. So now what the body thought was normal, which was, let's say, 98.7, now the body is told, no, that's not normal, that's too cold. 101 or 102 or 103 is normal. So the body does what it wants to do. How is it going to get there? It does many things. But because the body feels that it's too cold right now, we know one of the most common things of fever is chills, which to anybody at first glance seems counterintuitive. If the body is so hot, why are you shaking like we're cold? Well, it's very simple. The body now is experiencing a paradox. It thinks it has to be hotter, and therefore right now it actually feels cold. And that's why you experience chills that often come along with fever, especially a high fever. So what are the medical benefits? Was this just a bad process of the body that, HaKadosh Baruch Hu gave us? Of course not. HaKadosh Baruch Hu is a toiv and meitiv, and it has many benefits. One of the often benefits is an enhanced immune function. We have increased neutrophil migration, improved macrophages and T cells, so fever actually helps the immune system get stimulated. It also often prevents many bacteria from replicating. Many bacteria and viruses, as we know, at a certain temperature cannot exist. That's why we use other types of heating elements to sterilize certain types of medical devices. What about bacteria and viruses in the body? It's the same thing. We use heat from the body to prevent the ideal environment for bacteria and viruses to replicate. So not only does it help the body fight bacteria better and viruses, but it also prevents them themselves from functioning. And of course, we know, as we discussed, there's improved cytokine signaling as well, which helps coordinate some of the immunity. So there are many, many benefits to the fever as relates to the body. It's also well known that it prevents the reduction, it reduces iron and zinc from being available to the bacteria as well, and therefore they can't function as well. So it's nutritional immunity, it's physiological immunity, it is the prevention of viruses and bacteria from replicating. Sounds amazing, fever. Well, of course we know fever is not so amazing, especially when at 2 in the morning your kid wakes up crying. Certainly not the best time to have a fever. Always on an Erev Shabbos at 2 in the morning, on a Motzei Shabbos at 3 in the morning. It's never at nights, Monday afternoon. So what are the harms of fever? Of course we know we try to reduce fever. What are the harms of fever? So this adaptive fever, which we'll call it, has a physiological cost, which walks us into the pathophysiology of fever. First of all, we have increased metabolic demand. It's an approximation, but your body functions at a 10 to 12% higher metabolic rate for every 1 degree Celsius, meaning your body has to work a lot harder. And therefore it uses reserves, or if you're somebody who has minimal reserves, of course this fever can quickly put them into a much worse situation. There's increased oxygen consumption. Of course, with more oxygen, you get more carbon dioxide. That can cause myocardial ischemia. It can cause heart failure to decompensate, which we see many times. Patients who are metastable, when they have heart failure, even a small infection or a small fever can tip them over, because now they go from compensated to decompensated very quickly because of the hypermetabolic demands. And of course, respiratory failure as well in patients who have limited pulmonary reserve. We also know, of course, there's cardiovascular stress. We always see tachycardia, right? One of the signs of sepsis is tachycardia. The body's fighting. Well, somebody whose heart rate, is already going to be at a baseline tachycardia, or they have other conditions. As the heart is pumping faster, that's myocardial demand. Eventually, that demand can catch up to the patient, increasing cardiac output, reduced diastolic filling times, and these are high risk for patients who have coronary artery disease, atherosclerosis. It's like they're running a marathon while sitting in bed. Well, of course, if these patients ran a marathon, they'd be at high risk for a cardiac event. So too, when the fever is going, it's the same idea. We have neurological effects. Of course, dehydration is a major impact. We have a lot of insensible losses via skin, respiration, and sweating. Of course, that can cause electrolyte disarray. It can cause kidney issues. And generally, the body needs fluids to function. It causes hypotension. And therefore, as we've seen, fever, while on the one hand, it serves a lot of benefits, it also has a lot of risks. So it's difficult for a medical perspective to qualify fever as entirely good or as entirely bad, because we know there's benefits and there are disadvantages to the presence of fever. What's very interesting, to go from the medicine to the halacha, is that the Gemara, in a few places in Shas, which is not a chiddush, clearly knew from their Messiah that fever also has benefits, but it also has risks. What took modern medicine maybe hundreds or thousands of years to discover, the Tanaim and Amoraim knew this straight from HaKadosh Baruch Hu many, many years earlier. And you might say, really? The Gemara says fever might be beneficial. How could they have known that? Or the Gemara says fever is poor? Well, they just saw it on their own? So let's engage in a few minutes of the Gemara together, and we will prove that the Gemara already knew everything that modern medicine only recently discovered. The Gemara says in Nedarim, on Daf Mem Aleph, Hi Ishasa, this fever, Hilav de Parvanka de Malcha de Moisa. If it was not the agent of the Malach HaMavis, meaning if it wasn't that it always caused death or often caused death, it would be amazing. Mali Kichizra Ledikli, Chad every 30 days, meaning intermittently, it's amazing because it actually protects the body the same way the bark on a tree protects the tree. So this Gemara alone tells us it both is beneficial, like Israel Dikli, but it also is the Parvanka de Malacha, Amavis. It's also the agent of the angel of death. The Gemara says also V'chitaryaki legufi, like the antidote to a snake bite. That's how fever is. And the Ran says over there in this Gemara, yes, fever has amazing things. The same way the bark prevents a tree from the animals attacking it, so too does fever protect the body. If you look at the Eitz Yosef, he gives a little bit more in his medical understanding. We know there were humors in the body, and there were bad humors. Says the Eitz Yosef, the bad humors now get impacted by the fever, they get diminished. Memela, the body can now replace the damim lemarbe, the good humors, and the body can recover. So he understood clearly from the Eitz Yosef hundreds of years ago that there already was a physiological benefit to having fever. So we see on the one hand there's a benefit, on the one hand there's a chisaron. And it's not just one Gemara, it's amazing. It's also a Gemara in Psachim that says like this, Hi Ishasa, Timirta Nami Kishas Hasakana Damya. Somebody who has Ishasa, it's a dangerous situation. The Gemara in Avodah Zarah says, Ishasa Timirsa Kimakasha Chalal Dami. Very severe fever is like having an internal wound, which we know is very dangerous. So we see Gemara has a tension, and both are really true, as we prove from the beginning of this year. So how do the poskim, how do we reconcile? Is fever beneficial? Is it sakana? Is it aim by sakana? What do we do when we're confronted in halacha, lemaisa, let's say on Shabbos specifically, or Yom Kippurim, to mechal Shabbos, to eat or drink Yom Kippur? How do we understand and relate to and operate with fever? So if you look at the Shulchan Aruch in Shin Chav Ches Zayin, where he brings the halachas of refuah, so he says mechal in Shabbos, we are mechal Shabbos, amish yesh lekadachas cham beyoser im simur. If somebody has a high fever with simur, which are chills, so then we definitely mechal Shabbos. That's the Mishnah Berurah. What does it mean? Hu nikra b'lashon Ashkenaz typhus. In the olden days, the medical terminology, medical parlance, they used to refer to typhus as a constellation of diseases on its own. It was often a continuous high fever that often had, poor outcomes. Today typhus is typhoid fever. It's one type. Typhus in the olden days was a general terminology. Says the Mishnah Berurah, im simur hanikra shvedrin, which is chills b'lashon Ashkenaz, as opposed to the general, low grade fever that just is kind of continuous in the body and is not so dangerous. You have chills, you feel hot, they come together. That shows that the body really is in a state of sakana. It means the regular fever that's not so severe. First you're cold, and then you're hot, and you just stay warm. Says the Mishnah Berurah, that alone, just a low grade temperature that is maintained without any other chills, and it's only a ein basakana. It's not a life threatening, and therefore we can do things ayidei ein yehudim, ayidei shinuya maybe if we need, but you can't be over your own on an Isra de Araisa. So it comes out of the Mishnah Berurah that if it's a fever that's with chills, we assume that's a life-threatening illness, or potentially, and therefore a Yid, a Jew, can be Mechala Shabbos even in a normal fashion. However, if it's what we call a regular fever, it doesn't go into degrees, but a fever without any other signs or symptoms, without any chills or other systemic side effects, therefore it sounds like the Mishnah Berurah upon him, you would not be able to be Mechala Shabbos as a Yesh by Sakana. But many of the poskim say that's only a low-grade temperature, maybe 99, maybe 100. Once you get to higher temperatures, 101, 102, even if you don't have chills, that already indicates a real pathophysiology going on, and therefore you are in fact able to assume it's at least a suffix of yesh sakana. Rameshan or Chaim Aleph Kuf Chav Test says 101, 102. In that range, we can assume it's at least a suffix yesh sakana, even if nothing else is going on. If you look at Rav Vazner and Shevet Alevi, he says closer maybe to 104 degrees in Gimel Lamed Vav, but it's not really only totally in temperature, as the Achronim say, because often fever is just a reflection or an indication. It's a siman, it's a sign that something else is going on. For example, somebody may have appendicitis. Maybe they have no pain in the appendix, but they have a inflamed or infected appendix. That's dangerous. It could rupture. Or a gallbladder, or any other, or a kidney, or any other organ that may be internally located and it may be infectious. That's definitely a risk because it's halal shapnim. It's an internal deficiency, an internal illness, which we are always mechal Shabbos for. Says Ramosha, Shudafka im rak machmas tzina is only for, let's say, like a virus or a cold. Okay, so a guy who has 101 or 100 degree with a cold and nothing else, says Ramosha, that's not a sakana. If it's 101 or 102, just a cold, it would be. But let's say it's 100, but it's coming from an internal infection, an abdominal organ, an acute abdomen. Says Ramesha, yes, definitely in that case, it would be Machal Shabbos because we know something else is going on. Fever is just one of the signs, but we have an internal pathophysiology going on, an internal issue going on. And therefore, certainly, we're going to be Machal Shabbos. If you look at the Chut Shani, it's interesting. From Nissan Karel Zatzal, in Shabbos Dalet Perik Pei Test, he brings a very interesting story from the Chazon Ish, which maybe today in modern medicine we wouldn't understand, but this is halacha l'maisa, and we do act upon this Chazon Ish. Because even if it's not so high the temperature, but you know there's something internally going on, like Ramesha says. He says angina, which is actually tonsillitis, even though angina is a term in cardiac, but in modern Hebrew, angina is referred to tonsillitis, what we would call strep throat, strep pharyngitis. That could also be considered a suffix sakana, and therefore, potentially, even just with a low-grade temperature and tonsillitis alone, or pharyngitis, you might be able to be Machal Shabbos. He said, call it the you have to know exactly, but it's a strong possibility because now we have signs of an internal infection. That would be a reason to Machal Shabbos. He brings a very fascinating story from the Chazon Ish. It was on Yom Kippurim, the most Kaddish Yom in all of the days of the year. And somebody came to the Chazon Ish and he had tonsillitis with a low-grade temperature. They bring it down as 102 degrees Fahrenheit. Says the Chazon Ish, you have to be Machal Shabbos right now and hydrate yourself and do whatever you can to prevent your body from getting sicker. Really, strep throat, it's such a big deal. Yes, fever was signs of some type of internal organ infection, which the pharynx and the tonsils are considered in that madrega. But maybe you can be machal yom kippurim and make the person eat regularly in this case. And the Chut Shani Rizkrel says even if it's 100, 100.4, even lower, which medically we assume is already a real fever, that would also be enough. So you can't just say yes fever, no fever. You have to take into account the temperature, the other systemic symptomology, and the etiology of the fever. So you really have to look at fever on a more holistic perspective and go through each aspect of it to determine is it yesh sakana or it's ein sakana. But there's another element to it. Says Rav Moshe Feinstein in the same shuva. It's amazing. Rav Moshe goes through all the information over here. It's not just the temperature. It's not just the other signs or symptoms. But you also have to look, as we always say in medicine, don't treat the numbers. Treat the patient. Let's say the patient is immunosuppressed, or they're very old, or they're very, very young. Any environment where their immune system would be compromised, says Ramesha, in those cases you have to be much more concerned because the likelihood for a poor outcome is much higher, and therefore, even if it's 100 degrees or even a little bit less, says Ramesha, or a little bit more, you also have to at least have a suffix that maybe that's a real issue going on with the body, and therefore you have to treat that again as a suffix sakana. If you look at the Shmir Shabbos Kolchaza and Yud Beis, Yud Aleph Aleph, he says so to old people and immunocompromised would be the same category. So it's very important, just to summarize what we came up with. The Gemara has 2 points as to fever. Is it beneficial or is it detrimental? The Gemara says it's both. It can be both very beneficial and very detrimental, which he pointed out mirrors the medical understanding of what fever is. It has many benefits. It has immune benefits. It has bacterial, static benefits, but it also has very risks. We know insensible losses, neurological, cardiac, and demand requirements as well. We discussed from the Gemara and the Shulchan Aruch that through the Shulchan Aruch, fever with other signs and symptoms like chills is definitely a yesh sakana. We discussed that if it's fever alone, says the Mishnah Berurah, that would not be considered a sakana. But the place can say if it's enough of a temperature, 101, 102, 103, that maybe would suffice even on temperature alone. It also depends if we know there's internal organ that's causing the fever. Certainly that would be considered a sakana. Even tonsillitis would be enough. You don't need to have a coli or an api to be considered that you have enough danger. That would even be enough a tonsillitis or a pharyngitis, even from Yom Kippurim, says the Chazon Ish. And lastly, for Ramesha, even if all these things aren't so severe, but the patient is at higher risk because they're immunocompromised, because they're geriatrics, because they're very young, says Ramesha. Ramesha was speaking about children. Shmir Shabbos Kachasa adds old people and geriatrics, old people and immunocompromised. Any of those cases, it would also be considered a yesh b'sakana. I hope you had a nice overview. As always, we go through the medical information, and then we look at the medical information through the lens of the Mesorah, the Bala Mesorah, to the Gedali HaPaiskim. We have to go through what the Gemara says, what Ramesha, Rav Shlomo Zalman, the Chazon Ish. These are our foundations in halacha. Their positions are immutable, and those are the ones how we have to operate with, and make sure we reconcile their shitas with the medicine and not try to do the inverse. Everyone should have a tremendous hatzlacha in the limud and have a wonderful day.